Hello, everyone. Thanks for joining us on today's webcast, How to Handle Remote Access Security in Healthcare. We're taking a look at some data that we looked at from a number of different healthcare organizations, trying to figure out what they're doing with remote access, what are the biggest concerns they have, and what can you actually do about it to try and achieve goals, things like being more cyber secure, being more compliant, trying to make sure that you lower the cost of management. We're going to cover a number of different areas today, all revolving around your use of remote access. Now, in today's webcast, I am joined today by Fran Barnes. She is Customer Success Manager Team Lead over at RealVNC. Fran, thanks for joining me today. Appreciate you being here.
Hi, Nick. Thanks so much for having me.
Yeah, glad you're here. Now, for those of you in the audience that are watching this, we've got a number of slides. We're kind of going to walk through what essentially is a version of this remote access and healthcare report that we put together with RealVNC. And the idea behind it is to try and better understand what does it look like in your environment? How are you using remote access? Is it secure? Do you like it? Do you hate it? What is wrong with it? What's great with it? How does it meet your needs? All of those things in an effort to give you an idea of being able to kind of base your own organization's status of remote access with the rest of the industry and figure out are the things you need to be better at. Maybe you're ahead of the game. What else you should be doing to improve your state of, again, things like cybersecurity and compliance and so on. And so we're going to walk through this, and it's going to be a bit of back and forth where I'm going to present some of the findings. And then Fran is going to go ahead. We're going to have a little bit of back and forth, having a discussion about some of the data here in an effort to try and provide some context for you to see what other organizations like yours are experiencing. Now, the agenda is here. We're going to talk about what technologies are being used, who's using it, the technology challenges that you face as a healthcare organization, and recommendations that we have to help you address those challenges. The survey was done across, I believe it was over 300 different healthcare organizations, and got a wide range of responses here. A copy of this report will be sent out to you via email a little later on after the webinar, so be on the lookout for that as well. But Fran, if it's okay with you, I want to just kind of jump in and talk about the report and look at some of the data points and that sort of thing. You ready to go?
Yeah, absolutely.
Yep. I should also note, I did have a couple of cheat notes I just found here. 450 organizations from 62 countries, and it's a really good mix of SMB, mid-sized, and enterprise organizations in this report. So really a very relevant set of data points here. First thing we asked was what technologies are being used. And if you take a look at on the screen here, we're not going to cover every single one of these that's on the screen, but you can start with just a couple things here. On the left, you see that 40% of organizations are still using Microsoft RDP. I'm presuming for the most part, that's probably using internally. I'm hoping it's not external facing. That would be a bad move from a security standpoint. But you also see things like Citrix, AnyConnect, RealVNC, of course, TeamViewer, and the list kind of goes down from there. In hospitals and in enterprises, that 40% for Microsoft RDP was actually closer to 50%. So there's a lot of you that are using RDP, which in and of itself, if you're just using the built-in RDP into Windows, into the Windows clients and the Windows server, it's not completely secure because there's no policies being issued. Anyone can, in theory, log into any machine as long as they have a login locally rights, things like that. So there's even some concerns with RDP enabling lateral movement within an organization, let alone the idea of having it being externally facing, publicly facing, and it being an initial attack vector. So, Fran, where I wanted to start with just in looking at this list, and again, there's a long list. I think it's however we have 2, 4, 6, 8, 10, 11 or 12 different vendors here. Does this, I'll say, more or less line up with what you're hearing from healthcare organizations as maybe their prospective organizations are looking to maybe look at buying RealVNC and so on? It doesn't have to match exactly, of course, but does this line up? You see a lot of RDP. You see a wide range of solutions that are being used. And then I should also note that this doesn't add up to 100, which obviously means organizations are using more than one solution. Does this sort of line up with what you normally experience when you're talking to customers?
Yeah, absolutely. Specifically, when customers come over to us, they usually are already utilizing another tool. So RDP is quite common. I think one of the main reasons for that is in the healthcare industry, there's so many budget constraints globally. I don't think it's just in one customer base. So across the 62 different countries you've audited, yeah, I'm not surprised that kind of the cheapest remote access solution is kind of the most popular or the most used.
That's a really good point. I mean, free is really easy to access. It's a very low barrier to market to use free. But you already talked about, for example, customers using another solution. And as I've already pointed out here, this makes the case that more than one is being used. I think it's somewhere between 3 and 4 solutions, if I remember correctly. And but are you hearing from organizations that they have multiple solutions? Is that coming up as part of the discussion? And then, assuming that that's the case, and if so, then do you know why do you ever hear any kind of anecdotally like why they have different solutions?
Yeah, so with regards to the RealVNC offering, quite a lot of our, especially healthcare customers, will be utilizing our on-premise offering. Obviously, they want to keep everything secure and locked down on the local servers. And they have different layers of security, like firewalls, for example. So they would use us kind of primarily for that. But sometimes they're not aware that they can also have a cloud offering within RealVNC. So sometimes they'll have a separate remote access solution for the cloud connected side of their remote access solution. And then they'll use us for the on-premise side. So instead of, I guess maybe that's a kind of knowledge on what the tools in your current subscription has to offer. Mm-hmm. But we did actually last week have a customer come over to us from a competitor because of really bad customer service. So I think there's other factors that might go into that as well. Safe to say that we have asked them how their experience has gone through onboarding, and they're saying they're having a good time. So we're happy for the team on that part. But I think mostly it's that security aspect as well. So once they've got their initial product, they're then looking at their security requirements and thinking, okay, we need to go back to the market to find a solution that can actually suit all of our needs. And so hopefully we're fulfilling that with our kind of on-premise offering, as well as hybrid connections as and when needed.
And I assume that some of those needs, getting kind of practical, down to the weeds of what someone who's in IT is worried about. It's probably things like functionality, whether you can remotely control or if you just view, as well as what operating systems are supported, what other functionality is there, and then based on maybe even like we're going to talk about compliance later on today, but even like compliance mandates, maybe there's very specific security controls. Does this all sort of resonate? Is that sort of some of the reasons why maybe they haven't found everything they need in one solution, so therefore they have multiple solutions? Does that about sound right?
Yeah, absolutely. I mean, it would be great to have a kind of one size fits all product, but I don't think that would work. So one of the best things about RealVNC from a functionality standpoint is how it can really be molded to each customer's specific requirements, specifically on at that kind of functionality level.
Good, excellent. Let's talk a little bit about who's using it and how often. And so we asked healthcare organizations what they were using it for. And so I'm going to kind of go through all 5 of these because they're really good use cases. So you can see remote access to servers and network devices separately, remote access to employee desktop, remote access to healthcare devices, patient monitoring, and then monitoring for device management. So the first 3 sort of feel like I need to actively go in and remote control something, and I need to fix something in each of those 3 scenarios. Whereas the last 2 are far more focused on monitoring. Maybe it's monitoring that device is up and running, that it's functional. Maybe it's looking at very specific data on that device, whatever the case is, but there's a need there for that. And then also we asked how often is remote access used as part of the job? And this is a kind of a difficult graph to make sense of just because it's all these little parts. But the way that I looked at it was right in the middle there, the 28% and the 21%. So about half, 49%, almost half is right there. Somewhere between 20 to 60% of IT's job is half of organizations spend 20 to 60% of their job with remote access. And that's that kind of the way I looked at this to go, okay, that kind of makes sense here. That's a pretty material amount. It's 1/5 of the time to almost 2/3 of the time, or sort of 3/5 if you're a math person. But anyways, and it's being used for these tasks up top, these different use cases in descending order. And Fran, I'm wondering of these sort of options that are here, when talking to customers again, what's the greatest need? Is it kind of in this order, or does it depend on the hospital, depend on the healthcare organization? What's most important to them?
Yeah, I think obviously different healthcare organizations have different structures and requirements, but I definitely think the most common one is that remote access to servers and network devices, especially now that there's a shift in the healthcare industry to have kind of multiple purposes for one device. So we were chatting to a customer last week, and what they're starting to do is use tablet devices, so that instead of having to log onto a computer and kind of enter in their data that way, they can walk around with the tablets, the nurses and the doctors, to kind of streamline their time and processes, and focus on kind of what's most important, which is caring for their patients. So obviously access to those devices while the doctors and the nurses or other staff members are walking around is vital. So you don't have to send someone over, causes more delays and things like that.
Yeah, obviously the quality of care is the utmost importance here. I remember when I've been in tech for 30 years, and I've had hospitals as clients for many, many years over the years. And remember, we first had PCs in a room, and every room had its own PC. And then you go move to those rolling carts, which is still pretty cool. And then the tablets just make a lot of sense. Here's your tablet, walk around, hold on to it, and it's got everything you need. Obviously, can't dispense medication from it, but at least, it pops out the bottom of your tablet. That'd be pretty impressive. But if nothing else, they can at least provide some good quality of care because they have everything they need at their fingertips, and no one's looking for anything. So it really does create that. In each of these scenarios, when they come up, does security, is it always in the conversation? Is it sometimes not? I mean, it's just about the productivity gains, the idea of like, we can support them. Like your example you kind of gave, we can support somebody, they can get back to work. We don't have to wait for us to get there. That helps the quality of care. So does security come up all the time? Does it come up some of the time? I'm just curious.
Security is definitely the top priority list of, I think, all of our healthcare customers. So it's essentially that patient and employee personal data. They want to make sure that they can protect that. So we always start with security through the onboarding process. And then if we're discussing sort of customizing the solution in any other way, we have to go through the security team's approval first. So if we're having a conversation on functionality or performance, we've always got to make sure that if we are going to make any changes, the security team have kind of approved it and signed it off. So it's always a kind of security first approach, if that makes sense.
It does make sense, and it should be. In fact, we're going to talk a little bit about making sure that it is a kind of a security first approach, but please go on.
Yeah, I mean, one of the first things most of the healthcare customers do is make sure every session is 256-bit AES encrypted, so that every session is locked down and their patient's data is safe. Like, it's all stored on their local servers, so RealVNC doesn't have access to it either. It's all kind of locked down on their environment.
Fantastic. That makes good sense. I'm glad to hear it because I remember, I kept seeing like RDP showing up over and over again after the pandemic, and I'm like, haven't people learned that should do that kind of thing? And you'd think they would just know security first, and it's good to hear that you're actually hearing that. Let's take a look next at the most critical issues that are facing the healthcare industry right now. We asked the organizations to kind of list in order here. We also gave them another option, didn't get anything that was statistically relevant, so we stuck with our default options here. And to your point, Fran, cybersecurity is number one. The cost of management was number two, trying to keep both the cost low for the solutions as well as the cost of managing the solutions as well kind of comes in play, and managing all the things we talked about they're using the remote access for in the previous slide. You see compliance and regulations, adoption of AI and advanced technologies, and the list goes down from there. But you've got this, top couple of them at the top there. And obviously cybersecurity is top of mind for healthcare organizations. We see them as probably the number one target of cyber attacks pretty much every quarter. It's either them or financial services, and like they're vying for the top, so to speak.
Yeah.
So it makes really good sense here. But do these do these line up more or less with the conversations you're having? Do you see anything that's maybe lower that's typically higher in the list? Or just any surprises here? What's your thoughts?
Yeah, absolutely. The top two, I would 100% agree with, for what we were talking about earlier. And the cybersecurity and cost management kind of naturally tie into the compliance obligations as well. So things like GDPR, CCPA, HIPAA. So it's nice to know that that's kind of at the top of the mind there. It definitely aligns with what we're talking about, especially as we talked about earlier, that shift towards a digital approach. So adoption of AI and advanced technologies, that doesn't sort of cause any surprises there. But something that, something that's not on there, I suppose, is that kind of streamlining of processes and kind of making the teams more efficient so that they can focus on what's really important.
Which may tie into cost of management. It actually should say cost of management, not cost management there. That's a weird typo. I think we grabbed it, a screen grab, and that was in there. But and that may kind of tie in there, because the cost of management overall is how do we stop walking to building 4, floor 9, is using remote access. There's an answer, and then it's further streamlined that. So it may kind of fall in there. It's not listed here, but it's good to hear that you're that's one of the concerns, because I was actually going to ask, but I think you've kind of already answered, is when you're talking to prospects and they have their sort of list of requirements. Like you gave the example of a very, very specific requirement of like, oh, we want the sessions to be 256-bit encrypted, but thinking a little more strategic in their requirements, I'm assuming cybersecurity, the cost of managing and using the platform and managing everything else in my environment via your solution, that stays low. Things like that, regulations. I'm assuming these kinds of things are the requirements you're hearing about from organizations that are considering buying a new solution. Does that still line up as well?
Yeah, absolutely. And I mean, there's always new compliance obligations coming in as well. I know this one's about healthcare, but you can take, for example, DORA, which is a new kind of regulation coming in for the finance industry. But every year they're kind of reviewing those. So our customers have to kind of keep on top of those. Actually, one of the bring your own devices policies was something that surprised me. It's not something that's come up so much yet, because we've been talking about the tablets and devices inside the healthcare organizations themselves. But I would assume that the bring your own device policies might align with maybe like mobile devices to staff that are on call. So we'd have to be able to make sure that they're contactable at any time, especially if they're a specialist that are needed for specific use cases as well.
Yeah, I know that I tend to just default whenever I hear like bring your own device. I'm thinking it's some material device. It's at minimum a tablet, maybe it's a laptop, or it's a Surface Tablet Pro that's kind of been somewhere in the middle, as opposed to BYOD kind of could just mean your mobile phone. I mean, it's technically still accurate, that kind of thing. Yeah. So kind of interesting here. And then I noticed here that, of course we have, I want to go to the next slide because there's a juxtaposition here where we asked, and this is a little out of order, by the way, folks, but because I really should be covering that last slide, the one previous slide, next, because we're going to talk about the top 3 things that are in that list. But I want you to see this as some context, because cybersecurity was the #1 concern on the previous slide, and we're going to talk about it in another slide or so. But here I want to show this. It's a juxtaposition. We asked organizations to rank, thinking about their primary remote access solution. Again, they're all using more than one. And you see with security, 49% of them said that they would rank that their primary remote access solution was more a weakness than it was a strength. 49% said weakness, 34% said strength. And then you see collaboration, performance, and so on. And what's interesting is you don't get until you're down to, I guess it's total cost of ownership and price, that you start seeing where they're much stronger than they are weaker. And what's fascinating here is I was sort of surprised to see security at the top of the list, where 49% of them said, no, we see that there's a lot of weaknesses. There's security weaknesses in our primary remote access solution. And obviously it's supposed to be a high priority. And we hear that we see it here in the data that it is on the previous slide. And even you said, you hear it over and over again, security is top of mind. Any speculation on why they're ranking that there's weakness in the security of their remote access solution?
Yeah, the security teams are always looking for loopholes, right? So they've probably got a good security team finding all those risks for them to mitigate. But potentially, I suppose, with a remote access focus and the urgency driven within the healthcare industry as well, is potentially they were focused a little bit more on functionality and compatibility for the remote access tool. Just does it do what I need it to do so that my organization can work, whether it's a hospital or GP surgery, something like that.
Yep.
And then thinking, okay, it works, but now we need to build in security features like multi-factor authentication, encryption, user access permissions, things like that, that potentially the first remote access solution they went for doesn't quite fit. And then they have to kind of look elsewhere.
That's a really solid answer, because I've found that to be true across a number of disciplines within IT. I talk a lot about cybersecurity in my work. I do a lot around business continuity, do a lot around cloud adoption. And we tend to find that IT will start with what they perceive as the technical needs of the business, as opposed to starting with the business themselves. And I'm going to talk a little bit about this on some of the recommendation slides that we have. And sometimes things like cybersecurity get put to the back burner, even though we know that it's obviously, I mean, all of you watching, yes, I mean, we know all of you are worried about cybersecurity. It's not like any of you are like, cyber what? No one's doing that on this webinar today. Going, what's that cyber thing you keep mentioning? How do you spell that? It's not happening. And so what ended up happening, though, is you think of the pandemic as a really perfect example. Everyone scrambled. We got to get everyone remotely accessing the corporate network. And how do we do that? And the focus, and rightly so, because everyone was running so quickly, but rightly so, but everyone went to just, how do we get them connected? It wasn't, how do we get them connected securely and make sure that cyber attackers can't get in, and, all those other things. And sometimes, even though we're not pressed like we were with the pandemic in the time frame that we had to find a new way to do business, period, it still kind of happens that way, where sometimes cybersecurity isn't the forefront, because the really big thing, let's say for a healthcare organization, is I got to connect to Windows, to Mac, to Android, to Raspberry Pi devices, to Linux, to Unix, to, and they start listing out the technical things they need to accomplish just so that the business can run. And then the reality is cybersecurity isn't something that, this will sound wrong, all of you in the audience, but just hear me out for a second. Cybersecurity isn't necessary for the business to run, meaning it could operate without it, but then as long as no one tries to break in and, and take advantage of it and steal data, et cetera, et cetera, et cetera. But it's obviously that's going to happen still. So it's really important here. This makes good sense. So what I would do is I'm going to talk about the three top critical issues here that were on 2 slides ago. I've got them kind of summarized up here. The cybersecurity, the cost of management, the compliance with regulations. And I wanted all you in the audience just to see here that also we asked whether healthcare organizations were going to increase their use of remote access next year, keep it the same, or decrease. And you can see decrease was only 9%. And 16%, if you say no change or increase, it's 91% of organizations are either going to use what they're using today or more. 3/4, of course, being more. So it means that those 3 top things that are there, we definitely need to figure out how to try and address those. And we want to specifically talk about how to use remote access in general, and how remote access can what you could do with remote access to help improve your state of cybersecurity, improve your cost of management, and improve your compliance. So where we're going to start, Fran, we're going to start with cybersecurity here. And you can see on the left here, I've got a stat here that's actually from the Identity Theft Resource Center. They put out a H1 2024 report, and healthcare was the second largest industry, right behind financial services. You heard me mention that earlier today. They go back and forth, kind of a thing. But in the first half of this year, number 2 in the United States. And then a couple other stats here that I have that are not on the screen about cybersecurity here. I mentioned the 40% on average, and that it was 50% for hospitals and orgs larger than 1,000 users. I mentioned that at the beginning. Also, remember that 49% of organizations said that security was a weakness of their solutions. That makes it really kind of the big loser here in all of that. Was the biggest one we had of all of the different criteria that a remote access solution could be a weakness. Cybersecurity was the worst. And then just interestingly enough, on a topic here, because it's gonna be one of the bullets here, is MFA, multi-factor authentication, of course, was only used by about 2/3 of organizations, which is great, but it means 1/3 of you are not using it. And so the recommendations here, if we kind of walk down this bulleted list on the right, and then Fran, afterwards, let's run through these. We could talk about these a little bit here. Is the first one is actually something, Fran, that you and I talked about already. Trying to make remote access security a priority. When organizations like yours in the audience, when you're trying to look at a solution, it shouldn't just be about what operating systems can I access and what functionality do I have? Can I file transfer? Can I remote control? Can I just view only? Is it web-based? Is it on premises? Yes, those are all important, but it's also equally important to make sure that you have the security controls that your cybersecurity team, your CISO, that your CSO, your CTO, somebody has put together saying this is what our foundational set of controls needs to be in place. And can we find a solution that has all those controls? Or if not, can we get close to it? Or can we get close to it with maybe some compensating controls, something else we could put in place that would help if the remote access solution doesn't support it? Because keep in mind, not every remote access solution can necessarily do everything your organization wants. And also keep in mind, just because all of you are on here and you think, oh, we're all healthcare, you're healthcare, I'm healthcare. I can tell you, having designed the on-premises networks for a large number of different hospitals, every hospital had, like, I'll call it this way, a different flavor. They had a different way of doing things, even though they're literally in the same geographic location in the country, all subject to the same laws. They're treating the same types of clientele. Like, it's not, just like a place, let's say an older demographic of people. It's a wide range, and they all were a little different. So it's important to really realize that you've got to figure out what your organization needs, and not every remote access solution, or maybe any remote access solution, will meet exactly your needs, because yours are actually somewhat unique. Second thing here, always using MFA, and if possible, for every user that uses remote access, period, that would be helpful. That's just to make sure that I want you to think of it this way. Think of MFA as not just, we're doubly making sure that that the credential is correct and that they're able to get in because we know we know they have the right details. It's making sure that the user of a credential is the owner of the credential, or at least the authorized person to use said credential. That's what MFA is about. It's to make sure that the logical entity, the credential, is being used by the physical person or persons that are sanctioned to do so. That's what we're doing with MFA. So having MFA on remote access always is kind of really important here. Putting in other access controls, role-based security, which could be defining whether or not you could use things like elevated privileges on a system, so you could act as admin on a remote system or not, which systems you can access, is there a time of day of week. I mean, just any kinds of policies that may go into play there, having those kinds of access controls in place if they make sense based off of your organization's security strategy, your compliance mandates. If you're complying with some kind of framework that exists, a security framework, that's there as well. And then be concerned about RDP. Already talked about 40 to 50% of you using it. Fran's already laughing. See, don't do that. It's bad. Pick something else. Just because even if you're like, we just have it inside, you're enabling lateral movement. Let's see, last quarter, it's a company, Coveware. They put out quarterly ransomware reports. They're a ransomware response company. And of all the ransomware attacks that they responded to, I'm going to make up a number, but it's pretty close. It's something like 82% of the successful ransomware attacks that occurred had lateral movement. And of course, the threat actors will pull down some kind of tool that they can use to remote access. They can even use a remote access tool that's third party, that's just available on the market. But if you make it easy for them with RDP, you're making it easy for them with RDP. Don't do that. And the other one is consolidate solutions, just so that all the things that we're talking about doing in the first 4 bullets are under one roof. You know that you have the same security controls. You know that everyone's using MFA. You know that you have the priorities for the organization in terms of security have all been met, or at least best effort with the one solution. So that way you're trying to make sure that you know what your state of security is when it comes to remote access. So Fran, of this list, which do you think is most important here? Is there something that I've left out of the list that you're hearing from organizations, or something you'd just like to add? I mean, it's sort of an open-ended here. What are your thoughts?
Yeah, I think you've covered it quite comprehensively for the kind of most important factors there on cybersecurity. I would say, based on the conversations we've had with customers, it's making sure security is the priority. As I was mentioning earlier, when our customers are going through that onboarding process with a security first mindset, it makes it a lot easier to customize the security related parameters to fit those specific security and privacy requirements. And then it kind of sets them up for long-term success, and having a solution they can trust and rely on in the future, which I think is everybody's kind of main priority, right? You want something that will make your life a lot easier, and then you don't have to worry about it and changing it up too much. I would definitely say that, but also what our team, or the customer success team, do is we try and talk about the success goals. So security would definitely be one of those. Like, we want to maintain a secure network, but like, what else are we trying to actually achieve from this platform? And having that in the back of your mind helps to inform every decision that you'll make from there.
Excellent. Let's move on to the second one, which is cost of management. There's another question that we'd asked the audience that I thought was appropriate to show here, and we asked them what percentage of organizations think they're going to have an increased need for these specific areas that have to do with remote access. And you can see the need for patient monitoring, about 2/3 almost, need for preventative and predictive maintenance of devices and systems. And you see it 63%, a little less than 2/3, closer to half, increased number of healthcare devices and equipment. Have to try to support those, supporting corporate-owned endpoints, and then supporting BYOD. And of course, it's in descending order here. And so the reason why I bring this up is when you talk about the cost of management of each of these types of things, patient monitoring, predictive and preventative maintenance of devices like servers and so on, I presume, and desktops, healthcare devices and equipment, corporate-owned endpoints, and then BYOD, you need a solution that gives you the most capabilities to perform the tasks remotely, easily, centrally. I'll use the word predictively. You mean you know it's going to work every time, so that you can be productive there. Those kinds of things. And tied in with this, of course, is how easy is it to use like a single solution? If you have multiple solutions, you'll see the very first bullet I've got at the bottom, consolidate solutions. If you have 5 of them for various reasons, the ER uses this, and this particular building uses that, and that a particular floor uses some other solution, or these other types of devices have to use that. So, then you're having to know 5 solutions. You have to go and figure out what the passwords are for those different solutions, and maybe you have to have a PAM solution, a privileged access management solution that keeps vaults, secure credentials, that kind of thing. It just convolutes the work that has to be done. If you consolidate solutions that meet hopefully all your needs, and you have a single solution, you have things like complete visibility of all the devices. It's the same actions every time, right click, remote control, or that kind of thing. It just makes the cost of managing go down significantly, because it's a very simple process for you. Same solution, same controls, same credentials, same logon methodology. All those things come into play here. So that means the second bullet's necessary. You have to have a solution that's going to have a broad support of different operating systems as much as you possibly can, keeping in mind that sometimes remote control of a particular operating system isn't feasible because the operating system itself doesn't support it. And that's where the problem might lie. So kind of keep that in mind as well. And then this last one is kind of a different spin on the previous discussion about all of us in IT starting with our technical needs based on what we need to accomplish with the solution. And we forget about the other parts of the business and what they might need. And so this is about starting with the business needs. And the business needs are, of course, the things like we need to remote access every device on every floor, no matter what it is. Yes, that's for quality of care. But there should also be this discussion going back to that, like, make security a priority. There needs to be someone going, excuse me, another business need that we have is that it must be secure. The credentials have to be secure. It must support MFA. It has to use unified logging on with some central platform that we have to make sure that we know that it's not just application-specific credentials. Things like that. Those are very specific needs that the business actually does want in order to make sure that the solutions are secure as well as functional. And Fran, I'm thinking here back to the fact that healthcare organizations using lots and lots of solutions. There's different hospitals and specialists and urgent care. You even talked about this a little bit yourself. And that's going to materially add to the cost, especially when you have these larger organizations where they do have doctor's offices and they have specialty offices and they have surgical care and urgent care, and they're different businesses and they are, but they're all under an umbrella of a much larger, citywide or statewide or nationwide type of healthcare organization. What kinds of cost savings have you seen around management when they are consolidating solutions?
A lot.
Okay, next question.
No, you're absolutely right. The more solutions you have, the more expensive total cost of operations is, both financially, but also with time, as we were talking about earlier. And it's very similar to healthcare organizations trying to get multiple purposes from a device. They're also now looking, what other purposes can I use my software for? Like, what else does it do to help my staff's lives be a lot easier, streamline their processes so they can focus on what's important? And some of the key sort of conversations we're having is with customers, they no longer need a remote file transfer device. You can do that from within the remote session. You don't need another tool to record your remote session, because we can do that. Or like the additional security features that you were mentioning earlier with PAM and things like that, because we can centralize all of that into one area. So you can double check if all of these have been configured. And if you do need to make any changes for whatever reasons, it's really easy, centralized, and you can make that. And again, just save yourself time as well.
Yeah, excellent. There's I want to go to the one last type of issue here that we want to talk about, that is helping organizations comply with regulations utilizing remote access. There's a play here. And I'm thinking about, like, for example, if you look over at the detail I've got here on the left here, cybersecurity, even with strength and weakness of those that were citing compliance as a challenge, that's actually kind of interesting here. Because again, what I'm trying to say here is, if you look at this, the strength and weakness, when those people have said, oh, we're having a problem with compliance, back in that, what are your top issues? Compliance is a challenge. Cybersecurity and as a strength and as a weakness was, I think it was 52-48, if I remember correctly. And which means that even those folks are still having an issue. And the reason why I bring up cybersecurity here is the fact that you have most of the mandates that we're worried about, even starting with HIPAA and other regulations, it's about data security and data privacy for patient health information. And so the reality is, we're all using remote access. What are we doing? We're enabling somebody who's way over there to access data that's way over there. And there's no physical trace of them other than, there's logs and that kind of thing. But that's not like, roll the clock back 30 years when someone had to go get a file out of a room. And so it's really important to put very specific kinds of controls in place to ensure that the right people are accessing the right systems that might contain the pertinent data set that's there. And so I want you thinking about third-party authentication. That's one way of doing it, making sure that it's not, like I talked about this just briefly on the last slide, having, let's say, in-app authentication where it's just a database within the app. That's not a good idea. You want third-party authentication, leveraging a directory service, whether that's cloud-based, on-prem, something, so that you have a common set of credentials that are for a particular person that already has access to other resources within the organization. Then you have use of multi-factor authentication. Again, making sure the user of a credential is the owner of a credential. That's important. The role-based access, so that you define where someone can remote access to, what can they do when they get there. Maybe you only want someone to view only, and they can't copy any files. They can't actually do any work. They can't actually do screenshots. All this kind of stuff. You want to do something. You have some kinds of layers of role-based access to ensure that. And then using a single solution, just so that all these things you're talking about that you want to support, if you go, yep, check, I want to have all of that. you got to have probably one solution you're going to find that supports all of those things. And so, and these aren't all of the different types of controls you should have in place, but the idea is you have to decide what you want for your organization. These are just 3 that are kind of important. Yes, but you might also have some other ones for yourself here. And then Fran, kind of the same question I asked previously here. What are you seeing here that's the most important? Is there something that should be added to the list, you think? What are you talking to customers about? What's your thoughts there?
Yeah, I suppose from a compliance perspective, with our healthcare customers, we're focusing a lot on the right level of access for their users. And as we spoke about earlier, it's 1,000 times easier if you just have one remote access solution that you can centrally manage that from. But obviously in a healthcare industry, it's critical for the overall operations of any type of organization to limit access to those critical devices. Because if a server goes down, you'll be in big trouble. So we need to make sure that the hospitals and the organizations are able to function the best that they can. And if something goes wrong with the device, the correct people can remote into that and fix it, as opposed to somebody accidentally being like, oh, this isn't the device I should be in, and accidentally clicking on something and turning it off. And obviously that has a snowball effect that happens quite quickly. So yeah, definitely the right level of access from a compliance perspective.
I'd agree, and nobody wants compliance fines and all that other stuff here. So let me sum some things up, and we did have a couple questions come in that I'm going to try and see if I can answer. If you have a question, you can stick that in the Q&A box. We're running a little low on time, but if we don't get to your questions, someone from RealVNC will reach out to you directly and answer your questions, so don't worry about that. But in essence here, what we're trying to do is we're trying to figure out ways to help you improve operations management and cybersecurity through the use of putting this survey together and trying to focus in on how remote access can be used to meet not just the, hey, how do I fix someone's configuration on their machine or create an icon for them or something. It's actually, how do we do so as part of meeting the needs of the business, the higher level needs here. So hopefully you've actually been able to kind of think about over the last hour or so we've spent together, or maybe it's the last 45 minutes or so, about how remote access can actually play a role in helping achieve some of those larger goals. It's not going to solve the problem. Remote access isn't the answer to compliance, of course, but there are things you can do with remote access to make sure that it is aiding in compliance. It's making your cybersecurity stance stronger and so on here. And it really starts with the idea of what we said, I think time and time again, is as you're thinking about remote access, that you elevate its position in the conversation to a couple things here. I like alliteration, sorry, so I use 3 C's. See, considerations, capabilities, and consolidation. The considerations is what do we need as a business? Okay, and that's both the productivity side and the security side and the compliance side and governance side and any other side you want to throw in there. And then the capabilities. What can a given remote access solution do? I think you're probably going to find that if you were to come up with that long list of considerations, you will not find a single solution that does everything. So you're trying to find one that gets you closest to it. And then I used a term earlier that's actually a compliance term, which is compensating controls. When you don't have something that's going to meet compliance, but you're like, okay, instead of doing that, we do this other process over here. It's not exactly the same thing, but it helps us compensate and gets us at least compliant. You think of that term compensating control as a means of even like cybersecurity or governance or any other aspect. And then the last thing here is consolidation. And that is just consolidating solutions so that you can have to be thinking about one set of capabilities that are going to meet one set of considerations. So with that, I'm going to jump into questions here. But before we do that, Fran, do you want to tell the audience just a little bit about RealVNC and what I can do to help them in a healthcare setting?
Yeah, well, we've commonly been referred to as the most secure remote access solution in the market. And I think there's a few different reasons for that. Mostly, we have our on-premise offering and we're continuing to grow that. And we do have some exciting new features coming in 2025, but I'll let your RealVNC representatives tell you about those. But if you've got any questions, you can always reach out to us. But we also take security as a company quite importantly as well. So we've got our ISO 27001 certificates. I think we got recertified again this year, GDPR compliance. We've completed our white box audit, and we're very transparent with our customers as well. So we've got our trust page, so you guys can access those to help assist those conversations with your security teams as well. And we're always happy to help as a team. So I suppose if you want to find out anything else about the new features that are coming in 2025, or if you have any security related questions, you can just scan the QR code on the screen and one of the team will be in contact with you.
Excellent. Excellent. Appreciate that. So last slide here. Again, we got a couple questions came in. Milo's asking that most of their solutions are in the cloud. And said, and I'm paraphrasing Milo's question here, said you mentioned both on-prem and in the cloud. Would you cover that a little bit about what's where?
Yeah, absolutely. So with our kind of enterprise offering, you can have both an on-premise and a cloud solution within one. So we support a hybrid approach. So we'll never force you to go fully to the cloud or fully on-premise. We have the flexibility to do both within kind of one enterprise subscription.
Excellent there. And then Arun, again, paraphrasing, Arun says we have a wide range of devices. We're shifting to tablets on Android and wants to know if you support that.
Yeah, absolutely. So with Android devices, we have remote access and remote control. So if you did need to remote access into one of those tablets, it's definitely something we can support moving forward. Or any Android mobiles, if it's a bring your own device, as we spoke about earlier.
Yes, yes. And then Jeff is asking about, again, paraphrasing, we mentioned a bunch of different security controls, and Jeff's asking, which ones do you support?
Mm-hmm. Quite a lot. So I'll probably narrow down to the top three. Multi-factor authentication, which we've spoken about before. Very important for both cloud and on-premise. So we can have those ones. We've got the user access permissions, which is also very important from a compliance perspective. We can change it and group in devices, things like that. And then we've also got probably the most important, but encryption. So all of our remote sessions are fully encrypted, but you can also set a parameter to make sure it's set to the maximum level every single time, so you don't have to worry about it.
Excellent. Excellent. And with that, we are going out of time. I did see a question pop up or two. Again, someone from RealVNC will reach out to you and get your question answered. Fran, thanks for a great conversation today. I appreciate you being here and providing just some context around some of the data that we saw in the report.
Absolutely. Thanks so much for having me, Nick, and for everyone else for listening.
Yep. Thank everyone. Hope you actually learned something in the last, time we've been together, how many minutes it's been. Our goal is always just to get you to focus for the duration of the webinar timeframe, just to be thinking about the problem and then how you'll actually solve it yourself. And so I hope this give you some context and was actually useful to you. So thanks a lot for attending. And this is going to conclude today's webcast. We'll catch you guys on the next one.
Bye, Ron.